Hey there, Trista here. I posted an article today about healthcare tips and ways to reduce your cost. This is actually a personal thing for me because, as my article states, my husband and I recently had our daughter treated for something called trigger thumb. It's where her thumb remained in this position as that was the extent of her straightening it. We had surgery for it, so now it goes like this, and it happens in, like 2% or 1% of kids. So it's very rare, but for us, this meant that we had to travel about an hour and see a specialist and then have the surgery done again, so traveling again for another hour, and then, the follow-up and things like that. It's been about 2 months now, or going on 2 months, and so as my article states, that means the bills came in. And one of the sections that I mentioned in my healthcare tips was that you should be telling the doctor's offices that you're not going to pay their deductible up front. This is extremely important, especially if you're in a situation where you're going to a hospital for your care. Such as the outpatient surgery office that we went to. What happened was we paid our out-of-pocket deductible at the time of the surgery. That's what we were told to do, so that's what we did. Then we got our bill. And what happened was, and what my insurance company later told me was, that often the hospital is the first person to charge you the deductible, but the last person to file the claim. So my understanding is most insurance companies are actually a first-come, first-serve insurance, which means whoever files the claim first gets the deductible on their claim. And then whoever files second, obviously the deductible's been met, which met does not mean paid, which is also new lingo that I just learned. So what I can offer to you is this. In our household, this is how we will do it in the future, and I can suggest that if it works for you to do it, but ask that they bill you. Tell them that you'll be willing to pay the deductible after the claims have been filed, and you know which office is actually getting the deductible met and which is not. It sounds very strange and very convoluted, but what happens is if you pay the hospital like we did, and then the doctor's office files their claim first and the hospital files second, even though you paid the hospital your deductible, the hospital isn't paying your deductible. The doctor is now the one who met the deductible, meaning they're the ones who are charging you or billing you for the deductible. And the hospital, when they submit their claim, it's showing that the deductible's already been met, so they no longer need that. So what happens, my insurance company explained to me, was that it's very often a hospital will expect that no one else will meet the claim for the deductible and charge you up front. And what happens is they're usually the last person to file this claim, so it causes them to have to either refund money or whatever else happens. And if you have a co-insurance, obviously that's going to be taken off the top as well. But ultimately what happens is the deductible becomes a huge issue for billing as well. So the deductible is always on top of the co-insurance. So my short, brief video real fast while I'm sitting here thinking about it as I finish the article, and I just wanted to point out some of that because I don't know if it's very clear in what I wrote or not, but it was really important for us to learn that that the deductible, when it's met, does not mean it's paid, and that whoever files the claim first is the one who's going to claim the deductible on their bill as compared to whoever charges you first. So just because you pay the deductible to the hospital doesn't mean that that's who actually needed the deductible. So that's just something we learned real fast, and I just wanted to pass it on to everybody else. So good luck, and if you found this information valuable, if you're going to be using this in the future, I'd love for you to comment below. There is a link to my blog article as well, and be sure to share it. I mean, this is great information that people really should know. This caused us a lot of heartache. It caused us a lot of stress, especially since we're thinking we paid one person when we really needed to be paying the other. So I just wanted to pass that out and make sure I shared that with others so that they had the correct information, and you should really do the same. So I'll see you soon.